Welcome to Shreveport-Bossier Local Lens, the podcast dedicated to sharing the stories of the people making a difference in the Shreveport-Bossier community. Hosted by Jeremy Sutton, each episode dives deep into inspiring conversations with local leaders, creators, and change makers who bring unique perspectives and positive impact to our area. Hey, everybody. Welcome to the podcast today. I have the pleasure of meeting with Dr. LaTonya Mister. She's the owner of Sew and Reap Physical Therapy here in Bossier City, Louisiana. We're going to talk about her practice, her history as a PT, and just what she recommends for women and men for pelvic health. So, Tanya, it's great to meet you and great to talk to you again.
Likewise, Jeremy. Thank you for having me on. I appreciate you.
Yeah, it's such a pleasure. Your name came up a couple of weeks ago when I stopped by your clinic. And I was over at Dr. Cruz Chiropractic Clinic. So he and I'd interviewed him several years ago, and we've been friends ever since. And he's like, there's this amazing other PT that I had here with me for a little while. Now she's got her own business. And he said your name, and it was like the second or third time your name had come up that week. And I
Oh,
said, you know
wow.
what? I've been
Wow.
wanting to meet her. I'm going to go. I literally left his office, drove to your office, met you. And so I'm excited to talk to you. So just, kind of introduce yourself. Tell us, about your experience as a physical therapist.
Gotcha. So, I'm from Mississippi, Kilmichael, Mississippi, very small town right in the heart of the state. And so all of my schooling is from Mississippi. I attended Mississippi State University, got my bachelor's in kinesiology there, and went to the University of Mississippi Medical Center, and that's where I graduated with the DPT, Doctor of Physical Therapy program, in 2008, to be honest. So yeah, it's been a minute.
Awesome. Yeah.
And so we moved around quite a bit, military family. And with that, I was able to learn different things from different areas.
Right.
Oklahoma City is where I was introduced to pelvic health. And when people ask me, how did you get into this? I always say it was God's blessing to get into this because I went to Shadow. There was a clinic. All they did was pelvic floor, and all they did was women. Like they did no male at all. And so it was one little office with the urogynecologist, the PAs, like all of us was in this one office. So if I had any questions, I can just knock on the door and be like, hey, so what surgery or what did you do, And so when I went to Shadow for 2 days, they only gave me two. The two therapists, the director and then another PT. Well, she found out that her husband, the regular PT, that her husband was going to have a residency, it got accepted, us to say, residency in Chicago. And she was moving, and the director was like, well, do you want a job? So she asked me right on the spot. And I said, my mind, I swear, I had just told my husband the day prior, I'm like, I can't do this. Like, I can't do this. Like, because we do pelvic exams. Like, it was just
Right.
new, right? And my mind was like, no, but my lips said yes. And here we are. Like that, this was the best decision I've ever made. Like, I love the patient population. They keep me going. They keep me motivated. You hear the stories and you're like, we still live like that now? Like, it's 2024. Like, but it's just a blessing to be able to help other people feel like it's not all in their head. Because that's the statement that I hear the most in pelvic health. I always thought it was in my head, or I thought I was going crazy. No, you're not. It's true. This pain is true. So yeah, that's
Right.
yeah.
Oh man, that's horrible. We talk about how the stigma with mental health is starting to come down, but we still have this huge stigma with pelvic floor, with men and with women.
Absolutely, absolutely. I always say it's the taboo side of physical therapy, right? And that comes, believe it or not, Jeremy, I know you're a physical therapist as well, right?
Mm-hmm.
But I've even heard other physical therapists say, "Oh, you do that," like dismissive of it. I'm like, what do you mean? Like you
Right.
know, like it's like the
Yeah.
watered down version of physical therapy. And I'm like, no, if you saw and hear what we go through with these patients, like you would change your mindset on that as well. And so a lot of the things I find myself doing is education, patients, providers. Not that I know it all, but when you're in this for so long, I've been doing this for over 10 years. You just hear a lot. And so it's just like changing the mindset, even for the patients when they come in, men and women, that
Yeah.
fear.
Yeah, absolutely. I've been doing podcasts for I think 8 years now, and one week I went to an event that Greg Todd put on. I don't even remember what year it was, and so I interviewed like 6 women, and I did all women's health interviews. And the
Wow.
first one was Tracy Scher, who does Pelvic Guru, and she starts talking about all this stuff, and I'm just like, what are we
Yeah.
even talking about? Because one, I didn't get that education in school. I've been out one year, after you. I graduated in '09. And but still, like you said, people water it down. They dismiss it. You know, I had someone tell me one time they were getting a pelvic floor exam by their gynecologist, and they were like, it was painful, and he made fun of her and said, well, your wedding night's going to be horrible or something. You know, I'm like, what the heck
Yeah.
is wrong with people?
Absolutely, absolutely. And then, oh my gosh, the one I heard that I found, I laughed. I had to laugh with her, right? But I'm trying to, it's sexual, hers was sexual related as well. And
Right.
so her doctor told her, "Oh, your husband must have grown." She said, "We've been married for 20 years. I have two, three kids. I forgot, I don't know if she had two or three, but I'm like, your husband has, was he joking?" She's like, "No, he meant that." And I was like, "Oh yeah. Okay, so let's focus on you."
Yes, yes. We need to get rid of some of these doctors, PTs, whatever, and get in some people that actually want to help people. Yeah,
That's it. That's it.
yeah,
Meet them where they are. Yeah.
that's
Yeah.
right, absolutely. So, talk about what led you to open your business. I know pelvic floor, you got into that, but why open a business?
I wanted to introduce holistic treatment options that our practice may not approve of, meaning not our practice, let me restate that other providers or other business owners, like if I worked for a big hospital, they may have said, no, we don't want you doing that here. So we offer like yoni steaming, which a lot of people, they like to use it for like spa, like, ooh, come and get this steaming. But it really does help. Like we're getting great results with those with pelvic pain, especially. Now, it does help with those that are ladies that are prolapsing, but even men. I had this one guy, he came to see us. He had testicular pain with like jumping. He was very athletic. He said, every time I jump, I feel this pull. I steamed him, I kid y'all, one time. He didn't come back. He called me. He said, my pain is gone. I don't need to come back. That was one steam. So,
Yeah,
and the first patient that we received at Southern Reap was for dyspareunia or painful intercourse. And
mhm,
so I was like, okay, this is my chance. Like she's the first patient that I've ever seen. And I started steaming with her and then doing the other physical therapy techniques that we do. And yeah, and so in my certification, like I didn't just create this, like I went through
yeah,
training to steam, so I use it for the medicinal purposes of it, not just, oh, this is the new fad that's coming out. And
right,
so what a lot of people don't understand that when you come to Soar and Read and get the steaming, I go through a 15-minute questionnaire with you because I need to know what your body's doing and I need to know which herbs to use for your body. So it's
right,
not just, oh, heat and steam and nobody needs to steam and the vagina is self-cleansing. Yes, it is. And this is what I tell people on this. The vagina is self-cleansing. Your skin is as well. But dermatologists are everywhere, right?
sure,
So, so sometimes the body needs that help to get back to normalcy, and that's what steaming does. So yeah,
yeah. I love
yeah.
it. So, talk about what yoni steaming actually is, because I saw that you did that. I looked your stuff up, and but even as a doctor of physical therapy myself, I'm like, I don't know what this is. You tell us
Right.
about what it is.
And right. And so that's really, it's outside of physical therapy, right?
Sure,
So 'cause that's nothing, they don't teach that at all in school.
right,
And so, like you said, even pelvic health, they're starting to introduce that to the students. But when we were in school, that was something we learned continuing education.
yeah,
But yoni steaming is the use of herbs and heat or the steam to heal the pelvic floor, right? They're actually starting to change the name from yoni because yoni means vaginal just to pelvic steaming because they're
gotcha,
seeing that it's beneficial for men as well, right? Like the
sure,
example I just said. But what it is for us, we have, excuse me, four different herbs that we use: a cleansing herb, a disinfecting herb, and they do exactly what they say. The cleansing will cleanse out the uterus. The ovaries, they can help with scar tissue for those who've had a episiotomy or any type of C-section scar or any type of hysterectomy scarring. It can help with balancing the pH. It can just, even those postpartum, can help cleanse out and make sure that they have a full cleansing of the uterus and actually help the uterus contract back down to its normal size quicker than it would without it. So those are the two that helps really just if people have endometriosis, if they have PCOS or any of those cysts in the pelvic area, it's really good for that. And then we have the cooling herb, which is for the ladies that are postmenopausal who have vaginal dryness. Because I love telling stories, right? So there was a lady, she was in her 70s. She came to see us for vaginal pain, but it was due to her dryness. And we started steaming, and I kid you not, she walked away not even having to use lubrication anymore. Like,
Wonderful.
yeah. So it really does its job. Like no one can explain how it works. Even the lady that I train under, she's like, I don't know how this works. We just know that herbs work. Right. And so there are certain blends of herbs, and I buy my herbs from her. But I use that cycle analysis. And even if you don't have a cycle, we still use the cycle analysis to figure out what the body's doing. And it tells me exactly by the time I'm done with that, which herb that person could benefit from. So yeah.
Yeah,
Uh-huh.
I love that. I love, something you said and that I key on as because I'm a PT. You're doing things that insurance isn't paying for, or you're doing things that a bigger business would say, "No, we don't want to do that here because we can't bill Blue Cross or whatever for it." But
Right.
I mean, that's where our PT world's going that way for sure. But the
Mhm.
world in general is, hey, can you give me a good service?
Mhm.
Are you going to do what you say you're going to do? And how is it convenient to me? I'll pay for it if it works and it's convenient. So I love that you're doing that.
Thank you. Yeah, that's it. They want that holistic option, right?
Yeah,
And it's crazy. I had a conversation with a lady, I think it was yesterday, and she was saying it's wonderful to meet people who are giving ladies another option except hysterectomy, because
absolutely.
if something's wrong, oh, let's cut it out. No, like, like
Yeah,
can we try other things first to make it to cleanse out the pelvic floor and because a lot of the cysts on the yoni steaming side, that is related to a backed up lymphatic system. So we can improve the circulatory system or the lymphatic system in the pelvic area. Um, a lot of the cysts will resolve on its own. So yeah.
yeah, man. So listen, I know I just called you man,
I know I'm
but
not. I
it,
had two brothers,
but
so
yeah, there you go. So what you just said is huge because I have someone close to me. I'm not gonna say who because I don't want to get slapped later, but has heavy flow during their period. Has to have iron infusions. Probably needs to lose a little weight, and her doctor said, "Hey, you need to have a hysterectomy and get on diet pills next week." And just like was floored and upset and crying and was like, and I said, what in the hell are they talking about? Like that's stupid. No, you
yes,
don't need a hysterectomy and start diet pills next week. Hey, let's start eating right. Let's start some exercise. Let's go see maybe a pelvic floor therapist. More than likely should do that, and
yeah,
then let's move forward and see what happens.
that's it.
Not let's cut you open and pump chemicals in your body.
Yeah, that's it.
So
That's
what you're
it.
doing is huge.
Thank you. I appreciate it.
Yeah,
And that's what, again, where I say that all the time. That's where the passion come from. Like
yeah,
making sure that ladies know there are, and men, there is another option, you
yeah.
know. So, yeah.
I love it. So let's talk about, I feel like we've been talking about it anyway, but let's drive home a little bit further the importance of pelvic health and why many people aren't getting it.
I feel that a lot of people don't seek pelvic health because they don't know it's there. Like they
Mhm.
don't know they have that option. We do have some people who know someone like word of mouth and they're like, oh, let me look into it myself. But a lot of doctors, it depends on where you are, but I'm saying the South, a lot of doctors don't even know that that's an option for the patients either. So they don't refer, and then the patient don't do the research and they just believe, what the provider says, which is great. You want to, trust your provider. But I think that's the main reason they don't seek it. They don't know. Because once they
Mhm.
find out, they come and they complete their PT treatments. Um, so that's to answer that. Now, remind me, what was the first part of that question?
We'll be right back after a quick word from our local sponsors.
Hi everyone, this is Donisa Walker here with Learning RX Shreveport. So excited to be able to give you some quick tips to how to make your brain a little sharper and a little faster. Number one, hydrate that brain. If you're not drinking enough water, you're going to have short-term memory loss, and that is going to affect everything that you do from day to day. Number two, make sure you're eating magnesium rich foods because magnesium feeds those synapses in the brain and so that they fire off and they're nice and sharp. And I have found that I love a little bit of lion's mane mushroom because that helps with the memory connections. Also, one of the things that you can do is remember that games are important and a great way to learn to play. So pull out those old board games. They have lots of value and you'll be surprised at how beneficial that they are. Get out and walk, do some exercises, and get the proper amount of sleep that you need to keep your brain strong and healthy. And if you struggle, come see me, 797-8523. Looking forward to seeing you.
Now it's time for a quick tip to help you make the most of life here in Shreveport-Bossier.
My name is Lisa Arundel of Lisa Lou Fitness. I am a speaker, a podcaster, personal development coach, and a women's health and fitness coach. And I help women over 40 figure out what their purpose is, what is their mission and their dream here in Act 2, what would God have them to do from here forward. I also help them build an athletic, fit physique so that they can carry that purpose with strength, energy, and confidence. You can find me on Instagram at Lisa Lou Fitness. You can email me at lisaloufitness@gmail.com, or you can check out my website, lisaloufitness.com.
Now back to our show.
Yeah, why is it important to get pelvic health therapy?
Gotcha. So I believe that it is important because, well, everybody on earth has a pelvis. you know?
Right.
You know?
Yeah.
And you can ask Dr. Cruz. When I first met Dr. Cruz, I told him I'm not a competitor. I believe in chiropractic care. Like I do,
Yes.
like that adjustment. He has way more training on that than me, right?
Yeah, absolutely.
And so I feel like we all have pelvises, so we all need to know when to seek care and when something's wrong. And I get that question a lot. How do I know that something is wrong? And again, I use this. Well, you have a shoulder, right? So are you thinking about your shoulder at all? No, you're just, you're picking up things, you're writing, you're typing, you're not thinking about anything. Now, if you lift your arm and it hurts, it's like, okay, now your pain signals, right? They're talking to you. And so the same thing with the pelvic floor. And the pelvic floor consists of digestive system, reproductive system, and urinary system. So it's bigger than just Kegels. And it's bigger than just, I have pain with intercourse. Like there are some people who have urinary incontinence that's so severe that like you can feel their anxiety. Like there was this one lady, she walked into our practice. I literally, we talked the first session because I'm like, I see, like she was almost shaking. And all she had was urinary incontinence and urgency with the frequency as well. The fear of, I'm a grown woman or man, why am I wearing this diaper? Do I smell? All of those things that we consider taboo or don't talk about that. That's not ladylike or, professional, whatever. Those are the things we should be talking about because one of the biggest things that I drive home to all of my patients, male and female, if you're leaking a little bit, just a little bit, that's a sign that something is wrong.
It's going to get worse.
It's going to get worse. Absolutely. Why would it get better? Like we're not doing anything. So why
would it go away?
Exactly. Yeah, we ignore it. It goes away, but it doesn't. And so I was talking to a urogynecologist. I interviewed him like when I first opened Sow and Reap. We used to work together at that OU Physicians in Oklahoma City. And I asked him that question, why are so many ladies dealing with urinary incontinence and pelvic organ prolapse, right? And he said, well, we don't catch it early enough. If we would send to pelvic floor physical therapists early, then you can strengthen and educate and it won't happen. And that's why it seems like normal for a person to leak as they age. It's not normal. It's just not being caught early enough.
Yeah.
Right. So, yeah.
It's like cancer or anything, if we screen for it, then we catch it,
That's it.
If you don't check your body, you don't know that you have, a lump in your breast or wherever,
That's it.
So, I love it. So what should I be looking for as a PT, medical provider, whatever, to know that I need to send somebody to you for pelvic floor therapy or pelvic health?
Gotcha. So PT to PT, I would say maybe have a screening question on your intake form to say, hey, do you ever, I know you're more orthopedic based, but just ask, do you ever have any issues with just the pelvis? And if they say yes, then I would dig deeper. It could just be one line, right? And then like, you check yes that you're having issues in the pelvic. What do you mean by that? And if they say, well, I leak a little bit of urine, okay, pelvic floor. If they say, if you're working on them for their hip, right, you get a referral for hip pain and it's not getting better, it could be pelvic pain referring to the hip.
Sure.
So I do have some physical therapists that send me patients. They're like, we've been working together for months and nothing is helping. Oh, I had this one lady, her obturator internus was a 0 out of 5. It was completely atrophied. And I was like, oh, you don't have your obturator. And she did, forget what, she had another condition, but I was like, your obturator is the cause of this. It's not, so we had to address it a different way. Hip with Kegels helped her eliminate her pain. And she actually said by the time she left, she's like, I don't have any pain at all. So yeah, it's just
music to your ears.
Absolutely. Because sometimes it is a deeper cause, like it's in the pelvic area. What else did you look for? I think those would be the main things. If people could just screen, like you said earlier, screen for it,
Yeah,
to just add it to their intake form. Is there anything that other than, and I asked this question to my patients as well, is there anything I did not ask you that you want to talk about that you think I need
yeah.
to know, you know? And I refer out to orthopedics. I'm like, yeah, that's more of an orthopedics. I want to see to the
Sure. Yeah. I
yeah.
mean, one of the things I love about what you're saying, and I do this too, is I get to know people that I'm working with. And, we're not just trying to treat somebody for a diagnosis. We get to know that person. And a lot of times I end up knowing who their family is. And, not because I know their family, but because we just talk and I want to get to know them.
That's it.
And so just about, I have caught, oh gosh, my brain just blanked, caught Aquinas syndrome, I think 4 times in the last 15 years. And two of the people had to
Wow.
have surgery within like a week because, it's so
Wow.
severe. And so it's because I'm like, hey, do you have any incontinence? Do you have any numbness here?
Yep.
And I remember I didn't catch that on somebody one time, and thankfully another therapist did. And it was actually somebody who I had grown up with his kids.
Uh-huh.
And so I still know this person. I still talk to him today. And I'm like, oh man, I mess it up. And so then it was like, I'm asking this forever.
Wow.
Um, but just given that, hey, put pelvic issues question mark. That's
Yeah.
huge. I mean, anybody can do that.
Yeah. It's just one
Okay.
line. Yeah.
Yeah, one line. You have pelvic issues? I do. I don't want to tell you about it. Okay, good. So, it's okay
Or
to
you
have
can
awkward
say,
conversations.
absolutely. And they do. A lot of people, they are very, like, I not, we're in the Bible Belt, again, I'm from
Absolutely.
Mississippi. And so that right there makes a lot of people not want to talk about it. They're like, that's
Yeah.
not ladylike, or,
Right.
but to have grown men and women in your office crying, like, and I kid you not, when they come into So and Reap the first visit, my goal is to, who are you and what can I do for you? You know
Yeah.
what I mean? Sorry, my son's in the background. So
It's fine. It's fine.
you hear that? And so after I asked him that, my goal is, I'm like, let's come up with a game plan. What is your goal? Like, I
Sure.
had a lady who came in last week, and after, I won't say what she asked me, but it was she had dyspareunia. And
Right.
she's like, thank you for not judging me on what I just told you about my husband and I. And I said, no, that's not my goal. My goal is to make sure that you and your husband can do what y'all want to do without pain. That's it. I'm not here to
Yes.
judge. You're married. That's your,
Yeah.
oh,
You
you
know,
and the privacy of your home is yours. So
it's funny because sometimes, somebody will say something to me and I'll be like, it's okay. Jesus is fine with you having sex. Like he wants it to be pleasurable too. It's fine. I know we're in the Bible. I grew up in Louisiana too.
yeah.
Here in the
Yeah.
Bible Belt, and
Yep.
it's fine. And it's funny. It's not funny. It's actually sad.
Yeah.
Because I want people to be able to talk about the things that they need help with. Like that sex is a part of life. Like as a married couple, that you want to do that. And so
Absolutely.
it's important to
Absolutely.
get those things. And as a younger PT, I remember the first time somebody ever asked me about a position, and I was just like, "What? Whoa, stop!" But now, as I'm 43 and I've been doing this for 15 years.
Yeah.
I need to help you. I want to help you. I don't care
Absolutely.
if it has to be awkward. So what? I'm a professional, and the door we're this is private. So,
That's it.
um,
That's it. Yeah.
yeah,
And another thing that I love to tell the younger, like newlyweds, there are some people out here who still wait until marriage. But as I have a daughter and I have a son as well, but one of the things I have to even tell myself, do not scare your child, your daughters, in that subject, right?
mhm,
I've had patients come to me, and it's yes, they have a vaginismus, the involuntary spasms of the pelvic floor, and dyspareunia, which is again painful intercourse. But some of that with them is mental because they've been told. I had this lady actually said this to me. She said, my whole life, my parents told me sex is bad, sex is bad. Like she was raised that sex is bad. And as soon as she got married, they turned around and said, where's my
it's
grandkids?
good.
Yeah, where are my grandkids? And she's like, so anytime her husband would come near her, her muscles would lock up. Like I didn't think that would, but that's a real thing. And I could feel it during my examination. So I'm like, oh my gosh, like it's like hitting a brick wall. And I touched her leg and she started to tense up. And I said, well, and she said, it's because again, I feel dirty. And I'm like, she said, I know that's my husband. I know it is, but I feel like we're doing something bad. So we
Right.
really have to change the conversation with our young girls on
Yeah.
that topic.
Yeah, my wife and I had this discussion not too long ago about, so we had this, our daughter's 12, so we had to talk with her and all this stuff. And
Yeah.
we probably should have talked about it a little bit more before we did it, because I think I said too much, anyway, but like, but we have talked about, there's girls that start their period and have no idea what it is. Like they're in a shower crying because they think they're dying or
Yeah.
something's wrong with them.
Yeah.
And then, and so we've, my wife has talked to my daughter about that. And because we don't know when that's going to happen for her. And, it's different for everybody. But I mean, why, oh gosh, that conversation you have with that woman makes me cringe because I can't believe that someone would do that
Yeah.
to their child. And then exactly like you said, turn around, wait, where's my grandkids?
Yeah.
Well,
Oh
you've
yeah.
been spending 25 years or 18 years telling me I can't be, sex is
That's it.
bad.
That's it. Yeah. And some of us, especially, I was like that too growing up. I want to please my parents. I want them to look at me and say, we did a great job with that one.
Hmm.
And so I understand how that mindset can continue, even though you're grown now, it can
Yeah,
continue.
yeah,
So yeah, yeah. So with
absolutely.
that, I've really been seeking the help of a lot of sex therapists as well to
Good.
help with the mental health part of it. Yeah.
Yeah. I love that. It's as physical therapists have evolved, as medicine has evolved, I've seen myself more and more saying, hey, I love the people out at Clint Davis Counseling. There's other great counselors too. I just know most of them very well.
Gotcha.
Would you like to go see like a counselor? Because I feel like some of this is stress related. Some of this could be trauma related.
Yes.
I think,
Yes.
yeah, we need to do some physical things, but you also need to work on your mind.
That's
And
it.
guess what? And I go two once a month, so it's okay.
Good for
You're
you.
not messed up. Yeah. So awesome.
Absolutely.
Talk about how important it is to you to serve the community that we're in, Shreveport, Bossier City, and the surrounding areas.
Gotcha. So I'm not, again, not from here, right? And
Sure.
so I feel like being an outsider, people are always looking like, who are you and what do you want? It's like I'm here to take. Like, I'm
Yeah.
like, no, no, no. I literally came to serve, not just my patients, but the community. And like I tell everybody that's from this area, there's a lot of talent here. I don't know if y'all
Mhm.
noticed that, but there is a lot of talented people here in all different like industries and professions. And so I just want to I love meeting people and learning their stories. Like I love hearing stories, like telling stories. And so I feel like getting out, volunteering, donating my time, my resources, my knowledge, because I will speak, like I do some speaking events around here as well. Um, I just feel like it's making them believe that I am here to serve and not here to just serve myself and take and take and take and take. I'm gonna bring up this example, like 50 cents when he first came. Like I heard some of the, oh, what does he want? He's gonna take a, I'm like, can we give the man a chance? I know he's an outsider, right?
Yeah.
But maybe he can come and make some changes. And the only way he can do that is by number one, us giving him time to do it. And number two, him giving back, him showing, look, I'm not here to take from y'all. I'm not here to keep the poor poor and da 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 da. I am here to help. So that's
Yeah.
my mission. I listen, I try to find every organization, not just a certain type. Like, where are the people and who needs to be served? So,
Yeah.
yeah.
I love that. I love that. I mean, I love being, my first podcast was called the Servant PT Podcast. I love servant leadership.
Ah,
But I was talking to somebody the other day who's been on the podcast, so we've kind of become friends since then. Is I said, look, you have what's called a Goodwill bank account, and you have to
mm,
deposit into that account before you can take back out.
yeah.
And so, like, I think about when I came to your clinic that day. Like, you don't know who I am. I'm walking in. I'm thankful that one of my high school friends that I literally grew up with was sitting there because I'm sure afterwards you were like, who's this guy? And I hope you did. And hopefully she told you some of the truth and not all of the truth about me because she tried to steal my sister's Cheetos one time and she got mad at her anyway. But like, if you're not putting into that account,
Right.
then you can't take.
That's it.
Or you can try to, but then people know, hey, Jeremy's just taking from me. Tanya's just
That's
taking from
it.
me all the time.
That's
Um,
it.
and so
Yeah.
we have to show our community that we're here to love on them. We're here to serve them.
Yeah.
We're not just looking for the money that they can give us or whatever.
Absolutely. Absolutely. And I
So
make that a part of anyone that joins our team. I let them know we volunteer and it's not even a paid thing. We donate our time just to show people that we do care. Like, so, and they know that. So, yeah.
yeah, I love it. I love it. All right. So who's your ideal client?
My ideal client. So it's crazy because I'm doing a training right now that's saying who's your like client persona
Yeah.
or patient persona. And my ideal client, you want to tell that story, is going to be a lady age 35 to 40-ish. She's married with kids, college educated, or has a career. And she loves fitness, she loves health, but she knows that her body is changing and she wants to catch it early so that she won't get older and have to deal with, surgeries and a lot of medication. So yeah, that's it. She makes a lot of the decisions of the family, and health is one of the things that she wants her family to have. So that's my persona.
What's her name?
Oh, what did I name her? I think it was Leah. I think I named her Leah.
Awesome. Good. I love it. Yeah. I haven't heard anybody say it just like that in a long time, but I've done all that stuff too. I love that you just did that. I love it. I love that you know who you're looking for. So Leah, if you're out there, Tanya's looking for you. Come let her sign.
That's it. Come on in, Leah.
Yeah, exactly. Give us your contact info so people can reach out to you.
Yeah, so you can call our office at 318-553-5022, and you'll either talk to Stephanie or Trail. They are amazing people. You'll yell at them. And then you can find us online at www.sowandreappt, so that's 2Ps.com, or you can email us at info@sowandreappt.com. And sow is spelled SOW. I see some people put SEW, so the sow and reap.
We're sewing, not sewing.
That's it.
Awesome. Oh, Tanya, thank you so much for coming on the podcast and sharing just your passion and your knowledge with us. I thank you so much.
Thank you, Jeremy. Thank you for stopping by. Seriously, and tell Dr. Cruz I said hey, even though I tell him to.
Yeah, sounds good.
All right.
Thanks for listening to Shreveport Bossier Local Lens. Be sure to subscribe, rate, and share the podcast to help us spread the word about the amazing people in our community.